so we're back to do cervical extensors and flexors, and the rest of the thorax we will do as well. So I have William in the position of gravity minimized for flexors and extensors, cervical. When I ask a patient to do a motion, I am supporting his head and cervical spine in neutral. So watch when I don't. You see how he can fall into lateral flexion, or can be too much laterally flexed in the opposite direction. So you want to make sure you have neutral spine to start, okay? So just eye it up. Make sure that you're looking at your patient before you start moving. Because remember, these patients are weak and compromised cervical spines. So if I want William to do flexion, I'm going to position him in a little bit of extension, and I'm going to ask him as I support his head to go look at his feet, okay? So you can either verbally state it or what have you. But when he does that, I'm going to have my top hand, I can palpate his sternocleidomastoid, and on the bottom I can do as well while I'm supporting. I can have my fingertip on his SEM again. And I'm supporting as he does the motion. So William, I'm going to have you look at your feet, okay? Okay, so he did it really fast, but that is flexion out of 2, okay? So now, in order for me to give minimal resistance throughout the range for a 2+, I'm going to be at his forehead here. So I'm going to position him again on slight extension so we get full range of motion. Give him some 2-finger, very, very gentle resistance. Go ahead and look at your feet. Remember, that's a 2+. This, treat your patient, their head very, very gently and support fully. You don't want any muscle guarding and creating tension in the muscles. You can strain this area very easily, so guard with great, great care, okay? And support with great, great care. Okay, so now for extensors, I want to set him in flexion, so do full range of motion. So the motion I would like for him to do, passively I show him. And there we go. He's going to kind of look up towards me, I should say. And on this side, his posterior side, I'm going to just palpate his extensors on either side of the spinous processes. So I want to come over here, Shannon, just look at where my palpation hand is. So I'm just taking my thumb and my fingers and just palpating on either side here so I could feel the extensors kick in. So as he does the motion, I'm palpating and supporting, so go ahead and look up at me. And he rotates a bit. So you want him to stay in this plane. There you go. Okay. So now for my resistance on his occiput, I'm going to add some 2-finger resistance as he pulls back for a 2+. So go ahead and look up at me again. There we go. And that's your gravity minimized position. Okay. If that was all you were doing, you would get a support pillow. Make sure your patient gets up in the correct way so that they're not hurting themselves. When you support, don't remove your support. Remember, cervical spines are very, very fragile, as well as heads. So, okay, so now I'm going to ask William to rotate onto his back. You can grab that pillow between your legs and just, yeah. And he's strong, so I would just, no, you just bend up your knees and put it under if you want, but you can just leave it. That's fine. So now, if I had my patient, I would lower, for a patient who's very weak, I'm going to lower them and hold their head for them and help them to get into the position. He just popped up because you know he's strong. But for flexors, a 3 would be, so I'm just going to show you, just look at your feet. That's your flexors. And I'm here just in case, I want to catch him, just in case I'm kind of guarding. So go ahead and relax into my hand. Okay, so with a patient, you're always guarding. Okay, even though they're doing a 3, you're going to just hover and make sure if they can't lift, you're catching and gently placing their head back in position. So now, William, since you just performed a 3, I'm going to do the break test. Now, so I'm going to take one hand, and again, I'm really giving 2-finger, don't put your full palm on their forehead. You're just doing light pressure more so than your normal max pressure. So, and we'll work on this in lab, but come up and meet my hand, William. Now don't let me push you down. I'm still hovering, mid-mod max, resistance, and I'm still here to catch his head if he drops, okay? All right, so that's your flexors, so flip onto your belly. And just show them, yep, you can put the pelvis pillow there. He's a good patient, he knows how to do it. And so if I want cervical spine neutral, I'll put your arms by the side, you can just hang them off, okay? Now, I don't want him to be already in extension. He actually fits pretty good there. Okay. So I'm going to just laterally view how his position is. He's in a little bit. You want a little bit of lordosis here, but you don't want a lot of extension. I'm just going to place him a little bit more into flexion. So let me place your head, and you're going to look down towards your feet. There you go. Okay. So he's in a little bit better position here to do extension. So obviously this is against gravity for extensors. So what I'm going to have him do, as I'm here, just in case he can't lift his head, again guarding for 3, come up and look at me, look at me. There you go. Hello. Hello, nephew. So this is a 3 out of 5 for cervical extensors. Obviously, if I want to give him resistance, his occiput, again, is where my resistance hand goes, not a lot of pressure. Once again, he's going to come up, I'm going to hover, come up, meet my hand, don't let me push you down. Good. All right, and that's your break test for your cervical extensors, okay? All right, while he's here, I think we'll go straight into your extensors, okay, in your thorax and your lumbar spine, all right? So I'm just gonna have William rest his arms, do the other one just like so, okay? So we're gonna mock each step of the way, and in your handout it says what each grade means. So what I'm going to show you is how you would perform in comp as well. What does each grade mean? Okay, so for example, a 1 out of 5, a 2 out of 5, 3, 4, and 5 out of 5. We don't have pluses or minuses here for the beginning. You can do a break test for them. So at that point of 3+ and higher is normal, or your normal grading break test system. But for 1 and 2, for your thoracic extensors, okay, so I'm going to concentrate on feeling, palpating what's going on in his thorax, okay? Of course, we're going to go into extension, so he's going to lift his body some, and when we get to the 3 out of 5, we want to make sure he clears his pecs from the table, and so we'll get there, but I'm going to show you 1 and a 2, and then 3 and up. So I'm going to have William, can you put your forehead back on this table? We're going to keep him in neutral best he can so that he doesn't, torque his neck while he's trying to lift and is rotated. So I'm going to ask William now, I'm going to palpate as he does extension. So for a 1, he can probably lift some of his cervical area, but he's not going to be able to lift any shoulder, and he's going to kick in these extensors in doing so. For a 1 out of 5, go ahead and just lift a little bit. We're just going to perform as if he's a true 1. I feel them kick in. He just lifts his head. Go ahead, put it back down. That's a 1. Okay. I'm here in protection mode again in case he falls his head into the, softly. I want to gently let it down. So now, if he's a 2, he's going to get some cervical activation, lifting his head, and he's also going to get partial shoulder up off the plinth. So I'm still going to have my palpation here. Okay, so because we're still at a 2, and I'm going to ask him just do what the 2 means. So lift your head and just partial shoulders. Good. Okay, down. Perfect. Okay, so that was a 2. So now a 3. 3 is slightly different. He can fight gravity. So now I'm going to ask him to place his arms on his back. So both. So he cannot, rest or push with his arms. We're going to see if he can clear his pecs off the plinth. Now, with these, you can ask the patient to do a 5-second hold, and I could have asked him to do 1, 2, 3, 4, 5 on the 1, 1, 2, 3, 4, 5, hold it on the 2. I'm going to have him do it on the 3 so you can see it, but to save time, I didn't have him do it because we know he's stronger than that. So I'm going to stabilize at his legs. You can also stabilize at the PSIS if you want, but I'm going to stabilize here. And I'm going to ask William to lift his head and his chest, clearing his pecs, for a 3. I'm going to ask you to do that for 5 seconds so they can see truly how it would go. So I'm here stabilizing on his legs, and I'm here just in case I need to catch his thorax. So go ahead and lift, William, and count 1, 2, 3, 4, and 5. Perfect. And come down. Okay. So I'm looking to see, did he clear his pec muscles? That's your cue for the 5 seconds. Okay. So now for a break test, I'm going to do what I usually do for 3+ and higher. I'm going to have my resistance up here, T1, T2 area. Don't go on the cervical area, but your resistance is going to be T1, T2. So now, William, I'm going to give you resistance as you come up. Don't let me push you down, okay? So I'm going to stabilize in the same area, and I'm going to have him come up, meet my hand. So come on up. It's going to be mid-range. 1, 2, 3 is my mid, my max, and he is, go ahead and lay down. So he didn't clear his pecs that time. I could ask him to do it again, but we'll save him some grief. Okay, so this is your area, your T1, T2 for resistance. Now we go to lumbar. So I'm going to go starting from the 1 and 2 again, so you get the idea. So now I'm concentrating on palpating and activation of this lumbar spine here. So here's where my hands are going for palpation. So with the lumbar area, we're going to do the 5-second hold as usual, but I'm just going to show you real quick to save time. If he can do a 1 for lumbar, he's going to lift his head and lift his shoulders partially. So go ahead and lift your head, lift your shoulders partially, and he kicks in. He's a 1 for sure. If he was a 2, he's going to lift up a little bit more, okay, and kind of get to the pec area. Okay, so now he's a 2 and he's kicking in. So I'm just going quickly. So now, go ahead and relax. I'm going to ask him to do the same thing for a 3. I'm going to ask him now to clear his rib cage. So now I got to look as he clears his pecs and his rib cage. He comes off the plinth for a 3. I'm going to stabilize. Did you get that clear okay? You get that all right? Mm-hmm. So come up as much as you can, and you're going to go down to try to clear to here, your rib cage. I'm giving him a little tactile cue on this side. Okay. Go ahead. All the way up, all the way up, all the way. Good. 1, 2, 3, 4, 5, and down. Good. So that's a 3, clearing the rib cage. So now for a break test, I'm going to come down to T11, T12. So just at the most distal end of the thorax is where my resistance hand goes. I don't want to be on the lumbar spine, and I'm just going to do that break test as he comes up. So go ahead. I want to clear that rib cage first, and then I'm going to give him resistance. So come all the way up again. Don't let me push you down. 1, 2, 3, and he's good. All right, I knew he could do it. That's why I enlisted him. This is my Coast Guard nephew. It works out all the time. Okay, so we're gonna flip onto your belly. Or I'm sorry, off your belly onto your back. Okay. So now this time, let's go to, of course, the abdominal muscles, okay? You don't want a pillow here, but I can just let him relax into neutral on the towel. You don't want the thorax lifted because you want full range of motion when testing the abs, okay? He can be extended. I'm sure it's not going to bother his low back if you're fully extended. If your patients are bothered by this, of course you can flex the knees to protect the lumbar spine, and you can still stabilize, which we would be here doing so. So it's up to, he's young, he's capable in doing this. So for abdominals, okay, on your sheet you'll see it's all about the arms. You're still lifting for 5 seconds, but your arms for a 1 and 2, for palpation, I'm going to be here at the abs. So this is rectus we're doing. So he's going to lift his head and slight shoulders. Okay, too much. I should say head. We'll do 1. Head is a 1. Slight shoulders is a 2. Now if he clears, even too much, that's a 2. Right there. If he clears his scapulas, you can relax, then he's going to be a 3. So I'm going to have him do it, but I have to move his arms. So for a 3, he's going to lift his arms so they don't cheat. So some of your patients cheat. I have to stabilize at a 3. We're still doing the 5 seconds, so let's make this one the true 5 seconds. He has to clear his scapula, so I'm looking for that inferior angle to come off the plinth. So I've got to make sure it does. I'm going to have a little tactile cue here. So go ahead and come up off the table. Nope, too much. Right there. And that's what patients do. 1, 2, 3, 4, and 5. And the other thing I want to do now that he did that, I'm glad he did it, the farther they sit up towards 90 degrees, the easier it is. So you want to make that 45 degrees so it's a true test. Okay, so it's easier again if they're higher. So don't let them come up higher. You just want them to clear the inferior angles. The other thing is when you teach a patient how to do abdominal work, even in their crunches and what you teach them as exercise, you want the chin to lead towards the ceiling. You don't want them to bring their chin to their chest. So you don't want any, and then a lot of them do this pulling on their head towards their chest with their chin. So I'm going to have them do it again with correction. So think of chin and chest almost towards the ceiling, okay? So keep it nice and neutral spine in here, okay? So we'll still do that 3 again, 1, 2, 3, 4, 5, but let's try and correct that. Ready? So lift, 1, 2, 3, 4, and 5. Perfect. Okay, good. Much better. Okay. So now we want to do that was a 3. Now I want to do a 4 out of 5. So it's all about the arms. And I always do Macarena. I'll show you after. But this is your 4 out of 5 position. He's got to clear the scapulas again. So come up and do the 5 seconds. We do 1, 2, 3, 4, and 5. Perfect. And lower down. He's got good body mechanics now. Doing great. So now we're going to do a 5 out of 5. I want to put his hands at his temples. So just like this, William. Don't have your patient do that grasp behind the head. That will definitely make them do the pulling and yanking on their cervical spine. So he's going to do that again. Same thing. Clear the scapulas. And we're going to come up for that 5 out of 5. 1, 2, 3, 4, and 5. Good. Excellent. All right. Now, for obliques, we know that, as you saw, I was stabilizing every step of the way. As obliques, we know that it needs rotation. So remember what external oblique versus internal oblique when it activates. So if I say to him, he's going to lift and rotate his right shoulder to his left hip, that rotation is going to activate external obliques on this left side, internal obliques on his right side, and then opposite with the opposite direction. Okay? So the shoulder that's moving towards the opposite hip, the shoulder side is going to be your external oblique activation, opposite side, internal oblique activation. Okay, so, and it's the same. So the 1, the 2, the 3, the 4, and the 5 that we just did for rectus is the same with external, we just have a different rotation. So I'll just have him do 1 so you can see the motion. All right, so we'll have him do a 4 out of 5. Okay, so we'll put your, so as you saw, it's 3, 4, and 5 are the arms. And that's why I always say Macarena, how I teach you with the Macarena movements. You always can remember it. I usually sing and I dance and lay up. All right, so if he does an oblique, and I'm here with the obliques, external this side, he would lift and have to clear at least the left scapula. I don't want him on the right scapula either. I want him to lift enough, but he should clear this left one first, and then you should see that one lift as well. So go ahead and do an oblique, and he's fine. He does it perfectly, and we do it for 5 seconds and come down. Okay, so arms are the same, 3, 4, and 5. Now, for a 1 and a 2, the arms, I'll back it up. Arms are going to be by the side, and he's just going to lift. Well, it'll be partially, I'm going to palpate here, partially with the head, and I'm palpating as he does that for a 1, and then it's going to be partial shoulder, okay, palpating for a 1 and 2, and I'm guarding. Okay, that's good. Holding it for 5 seconds. I'm just trying to hurry up here so we finish. The last one, okay, I'm going to come on this side. The last one on your list is quadratus lumborum. Quadratus lumborum is a hip hiker. So the action I'm going to do, and this is gravity minimized, I'm going to support his leg, okay, the entire leg, and I'm going to have his pelvis hike up towards his shoulder. So I'm going to have you bring that pelvis up towards your shoulder, but leave the leg relaxed. Yes, perfect. So and this is sometimes a hard thing to do, to have a patient do, but he did it right away. So I'm palpating quadratus. He's going to hike that pelvis up. Perfect. And that is your gravity minimized position. I'm supporting the entire leg as he pulls. You don't want to pull on the leg. For a 2 out of 5, I'll show you where you would pull. The the resistance hand for 2+, and also for your 3. Is right at the iliac crest. So I'm pulling distal as he pulls up. So go ahead and pull up. Good, and that's a 2 out of 5. So the against gravity position for the hip hiker, you could just stay here, I'll just do it, okay? He would be standing on one, on a stool with one, and he would lift with the other, okay? And I don't have a proper stool for you to sit on or stand on. Oof, I'm getting tired. So I'm just going to show you here. I would resist for a brake test as he hiked on that side. I would have him supported by putting his hands on my shoulders. So this is against gravity, hip hike, resistance goes at the pelvis. Oh, and that's it. We're done. Thank you.